Montana is an integrative wellness educator with a focus on the mind-body connection and a holistic approach to healthcare. She completed a Master of Teaching at the University of Toronto with a research focus on supporting the mental health of students. During the height of the pandemic, she created and facilitated responsive programming to address the mental, emotional, and physical health needs of adolescents and adults. She is dedicated to helping others navigate their journey to well-being through yoga and meditation, and is passionate about providing her students with a safe and friendly space to access their own healing potential. Montana speaks out about her personal struggles with chronic health challenges, including ulcerative colitis, and advocates for an integrative approach to physical and mental health. So I'll pass things over to Montana now.
Great. Thank you so much. You can go to the next slide. It's so wonderful to be here with all of you. I really, really appreciate you all taking your time, and I appreciate Crohn's and Colitis inviting me. I think that the most important thing is that I am a patient. I have struggled with I started struggling with my mental health before I was diagnosed with colitis, and it was just exacerbated quite significantly after I was. I had a pretty difficult treatment, lots of traumatic surgeries, lots of difficulties. And it's kind of just been this thing that's always been a part of my journey. And when I was diagnosed, nobody was talking about this. So I think part of the reason that I'm so passionate and I have become like a patient advocate is because I was just so confused about what was going on and how to help myself. So I just want to kind of reiterate that there are now 38 people in this room, and like, even if you feel like you're alone, you're not. We're here for a reason in this Zoom room on a cold Wednesday night, because this is a really important problem, and it's so incredible to hear Dr. Tripp and his students we're talking about this, we're understanding this, we're starting to figure this out, right? Something that patients have always known, how incredibly mentally difficult it can be to be a patient with this disease. I just wanted to highlight one more thing, that I now work at Sick Kids in supportive care research. One of our studies is using a yoga intervention to help with symptoms. So quite a different diagnosis, but I've had both. And unfortunately, a lot of the mental health struggles of just being a patient and using yoga as a tool to heal is really, really exciting for me, and something that's been immensely helpful in my own life. So you can go to the next slide, please. Yeah. So this, because I really want to give you all like really tangible things to hold on to and to help you through your journey. And so for me, this resource, so first of all, I'll just say that, I really resonate with the discussion about adverse childhood experiences. Like, I had a lot of childhood trauma that I can now identify as childhood trauma that certainly play into my picture of chronic health issues and mental health issues. And so through that work and trying to understand and untangle my trauma, I discovered this incredible resource, the National Institute for the Clinical Application of Behavioral Medicine. So this is where this resource comes from. The acronym is NICABM, if anyone wants to Google that. And so they kind of break down into 4 core strategies for managing stress and anxiety. And so the first one you can see is attention centering techniques, right? And so that's really what meditation is. I think that meditation gets this kind of, people misunderstand what it is. So it's not about clearing your mind. There is no such thing. I mean, maybe some Buddhist monks are able to clear their mind, I'm not sure, but it's really about choosing to witness those moving thoughts rather than identifying with them. So when we're patients with IBD and when we have these thoughts, when is my next flare going to come? Like, I know that that's a thought that has plagued me for almost 20 years. So, what can we do? We can think about meditation as a way to just sort of take that focus away from identifying with that thought. So meditation is paying attention on purpose in the present moment. So if we choose the breath as our tool, as our center of focus, then we choose intentionally to focus on the breath. We're paying attention on purpose in the present moment. We're not thinking about the last breath. We're not thinking about the next breath. Of course, anxiety is like, we're constantly worried about the future, and depression, we're all oftentimes perseverating over the past. And so we're often caught between these two worlds, not just as IBD patients, but also just as human beings in this world. And so when we're like, no, I'm going to focus on now, I'm going to focus on my breath, I'm going to make it the most interesting thing to me. And my thoughts are going to, get swayed off track a million times. But every time I notice that my thoughts are swaying and bring it back to the breath, that's when that muscle is working. And it's just like going to a gym and working out your physical muscles. It takes time, it takes practice, it takes dedication. But it helps. It really helps, because I think as IBD patients, oftentimes, especially when I was younger and I would go to therapy and I would say, I'm scared of my disease coming back. I'm isolated from all my friends. I'm so embarrassed. This disease is so incredibly embarrassing. I'm a burden on my family, like all the things that they were talking about. When you're dealing with an illness, especially when you're with a therapist who doesn't necessarily have expertise, like they're not unreasonable thoughts in a certain way, right? And so I think that we can often, if we're just stuck in the cognitive, we can kind of rationalize why everything is the worst. And the smarter you are, the more your brain can be used against you. So I think that that's where meditation plays a cool role, because it's like, okay, you're thinking about that. All right. It's just the thought, and you're going to bring it back to the breath. You're going to bring it back to sensations in your body. And it's without judgment. That's also the key, So now when I'm starting to go down a really bad thought rabbit hole, instead of judging myself for having those thoughts, I just kind of, when I notice, I bring it back. And maybe I'm focused on my heart, or maybe I'm focused on my breath, or maybe I'm focused on the sensation in my fingers, or it's just a tool to bring me back. And I will go into these awful thought patterns so many times, but I don't judge myself and I bring myself back. So that's about the attention centering techniques. And that's about neutralizing the anxiety. We're not trying to push it away. What we resist persists. It's true. We're not going to resist the anxious thoughts. We're just going to kind of notice them and redirect our attention. Then we get to step 2, which is the expressive creative strategies. And so this is about channeling those feelings. So I'll give a personal example. I had a doctor. So I had a podcast for a bit called Life Support. Again, everything I do is just trying to figure out kind of what's going on with me. So I invited these doctors on. We talked about addictions, and we talked about psychedelic assisted therapy, and just lots of different topics. But one of the doctors basically prescribed me. He said, I really think you need to do improv. So I started going to improv classes. It was completely terrifying. But then what I started to recognize was that it was so healing for me. And I think it's because of this. It was a way for me to channel all the anxiety and fear that I felt in these ridiculous characters. And I mean, there was lots of other benefits. It allowed me to bond with people in a way that had nothing to do with anything other than these silly characters that we were playing, because I was so stuck in my patient identity. I think that's another, for me at least, huge factor in my depressive and anxious symptoms was I am a patient. I am defined by these things. And so doing creative, expressive strategies not only gives you an outlet, but it also allows you to connect to those other parts of you that have nothing to do with being a patient. When you go to a lot of hospital appointments and doctor's appointments and you're asked your symptoms, you kind of just start to, at least for me, think that that's who you are. And it's a part of us, right? So, and I think for the expressive creative strategies, people might say, I'm not creative, I don't know how to do this. And I totally understand all of these strategies. You can choose one little baby step. But I think the key to this one is think about what you loved when you were really young. because I always loved acting and singing and dancing. And I was a very like expressive, dramatic person who loves speaking to other people. So I kind of forgot about that for a long time. I was this very, very insecure, shy person who thought everyone knows that I have an ostomy. Everyone knows that I'm sick, you know? But then when I rediscovered those things, that's really been allowed me to have those outlets. So that's number 2. Number 3, reflection exploration strategies. So this is where we can start to reflect and say, oh, you know what? Whenever I hang out with that person that I thought was my friend, I feel really shitty after. Or whenever I scroll on Instagram and I see how everyone's on a vacation and I'm like sick, I don't feel good after. So when I'm working with teens on the self-esteem program, like, I'm not judging them on their social media usage. I'm just saying, does it make you feel like, is it a useful thing for you to do? Do you enjoy it? You know, and so many of these things we do kind of just automatically, we don't even notice if they're actually bringing us joy. And so I think reflective exploration strategies like journaling, another thing that I completely understand, it's a little bit hard to get into, but there's different ways to do it. You could even like send yourself voice memos, or sometimes I think, oh, what would I say to a friend? And then I write it down, or, you know, there's different ways to reflect on what actually brings up anxiety. For me, going to doctor's appointments, going to my gastroenterology appointments was very triggering. So I thought, okay, what's the best way that I can set up this environment? Maybe I need to meditate before. Maybe I need to bring my mom. Maybe I need to like reward myself with a tree, you know, just kind of knowing what your triggers are, not to judge yourself, but just to kind of give yourself opportunities to get a little bit ahead of it. So I think that for me, writing has been a hugely beneficial thing. And it's really cool to just continuously explore our inner domain so we can understand ourselves a little bit better. And then for healthy lifestyle and values, that's really kind of like the most all-encompassing thing, right? So Dr. Tripp and his team are talking about how if you're not sleeping, like you're really setting yourself up for disaster. So we want to kind of set up as best as we can, because it's so easy for us as IBD patients to be really hard on ourselves and to think we're failures. And I don't know, I just find that we just lack some confidence sometimes as a group. And I think that we can take little baby steps, right, towards feeling healthier, which means in our relationships, which means our habits, our environment. And again, like toxic relationships, that, you know, they can make us feel just as depleted as not eating well or not sleeping, right? Like all these factors that make up our environment affect us very deeply. And we're talking about a disease that affects our gut, and we know that our gut and our brain are so intricately connected. So everything that we can do to give ourselves feelings of pleasure and comfort in our home and our environment, and not just cutting out all the rest, is super important, so that we can even begin to do these other strategies, right? Like the healthy lifestyle is kind of the first stepping stone, and then we kind of go from there. And it's also like treating ourselves well, right? Like when you give yourself a drink of water, or when you allow yourself to rest, you're saying like, I am worthy of this. And sometimes when we have those really, really negative thoughts, again, it's hard to counteract them sometimes with other thoughts. But what I've found is when I start to actually do actions to take care of myself, that is really powerful. So I'm showing myself that I'm worthy of that care and attention, if that makes sense. And then the thoughts kind of quiet down over time. So that was a lot of talking. We can go to the next slide, which I think is, okay, there we go, perfect. So for me, yoga has been fundamental. And I was talking before about how I really identified with this patient label, and I felt very much a patient. Patient means passive. Like you don't want to identify as that. It can be part of your identity. It certainly is for me, but it's not our whole identity. And I think sometimes being, again, in doctors' offices, that is kind of the role. Like, you are the patient and they are the doctor, and they are giving you strategies, and thank God they're starting to, you know, there's a lot of research, a lot of more patient engagement, and that's great. But it does still feel a little bit passive, right? You're getting the medication or you're getting the surgery. So I think for me, yoga was one of those things where, oh, I'm just like doing those acts of service for myself made me feel like I was taking care of myself and I was worthy. Going to a yoga class, and I'm talking like restorative yoga, like this is not, you know, really intense power yoga that I'm talking about necessarily, unless you're feeling really great and you want to do that. Like, it was kind of like, oh, I am doing this for myself. There's a role for me in my own healthcare. And I think that's a really, really important thing, especially when you have a chronic illness. We want to be part of our own healthcare team, right? We're the one who lives with ourselves all day, every day. It's so important that we feel empowered in our own care. And I think yoga was a really, really powerful place where I could start to feel that, where I could start to feel the connection with my body in a way that had nothing to do with medical procedures or pain. It had to do with just movement and feeling and being with other people in this non-patient-y way. So there's lots of ways that a more trauma-informed yoga practice can support our healing. And you can see all of those here. But I think for me, it was really this idea of, how do I befriend my body? I have had health struggles since I was a very, very young child. And I think I started to internalize this idea that my body was against me, that my body was an enemy. My body kept wanting to hurt me. My body was scary, was dangerous, was gross, was embarrassing, was shameful. And that is such a devastating place to live. Like, this is our home and we want to feel at home here. So how can we feel at home when we feel like our body's against us? We can't really. So how do we start to invite more compassion towards ourselves and more understanding and more tenderness? For me, it was a really powerful tool. So with that being said, I would love to do a little bit of breathing, of movement. It'll all be really gentle. You'll be seated the whole time.